We wanted our patients to believe in a better way. They are noticing things are changing the way they're being managed by their physicians. I want them to know, I want them to believe there is a better way.
And we have thought about the innovation, we've thought about the independence, and we're going to get you to the right doctor.
Or it's more than just saying, here's a diagnosis, here's a prescription, here's understanding, here's how you can feel better and not worry.
That's a lot what Helios is.
Welcome. I'm your host, Angie Swartz. A urologist, a neurosurgeon, and an otolaryngologist walk into a bar. Should we say a podcast studio, right? It's not the beginning of a joke, right. But they are all here today to talk about access to the highest quality of healthcare, access to doctors, innovation, and what all of that means to your healthcare, and particularly with Helios Specialty Healthcare. Thank you so much for being here with me.
Thank you for hosting.
It's our pleasure.
Thank you.
Let's introduce you. We have urologist Dr. Matthew Spellman. We have neurosurgeon Dr. Michael Polinsky. And we have our otolaryngologist, Dr. James Hartman. Let's start with Helios, what that is. You are the CEO of Helios Specialty Healthcare in addition to being a practicing urologist. So we'll start with you. What is Helios and why is it needed in our region? Why is it needed for healthcare?
Helios came from the formation of a perceived need. And as healthcare morphed, as life becomes more complicated, as the way the patient and the physician relationship has changed, we saw that dynamic being something, especially in the surgical specialties, that was becoming more removed. And what I mean by that is we wanted to guard that relationship, the relationship between the patient and his or her surgeon. And it came from that basic premise that patient is first. We want to make sure that we always guard that relationship. And those barriers, those things that get in between the patient and the physician are something that, we should regard as sacred. And those barriers are things that we should try to keep at a minimum. And then from that, trying to have a conversation with the best doctors in the world, right? And we're very blessed in St. Louis to have a very, very good healthcare environment. And then, as I always say to my kids, try to surround yourself with people a lot smarter and better than you. And that's what we've done. Innovation and independence, that's where it came from. We wanted the physicians to maintain their independence so they could guard that relationship with the patient. And we wanted to breed an environment that really beckoned innovation. Helios was this cool name. With the help of these two gentlemen in the room and some other folks, we wanted to bring something that sparked interest and also told people who we were. And so the Greek god of the sun is Helios and the keeper of oaths. So we thought it would really be important that the patient knew that the oath between them and us is very real and very tangible.
Helios Specialty Healthcare is what we call multidisciplinary organization, physician-run, physician-led, which provides specialty surgical care. This enterprise, I think, was triggered by a real need in the community for something different, something better. We collectively realized that we needed to sort of build something that was going to give patients access to healthcare, but also a very different kind of healthcare. I think patients in this community, I'm starting to notice, are realizing that something's changing. Mm-hmm. Something's changing about their relationship with their doctor. They don't feel like they're getting the same level of compassion, the same amount of time, and we feel it too. That relationship is destructive in two ways. I mean, it isn't good for the patient. It's not good for physicians. Physicians, the vast majority, have very good intent. I mean, they really want to take care of patients the right way. But there are very profound changes taking place in healthcare which are limiting physicians' ability to do that. How much time they can spend with a patient, for example. How much time they have to spend on their electronic medical record, for example. And physicians at the end of their day who have to behave in this way don't feel valued. They don't feel like they're doing a good job, and they fail. And we all very, very acutely realized that this is going on in the community. We wanted to build something where we, the doctors, Helios doctors, are in control. We are going to determine how that patient can access us, how we're going to document, but most importantly, how much time we're going to give that patient. We're going to be really, really good listeners, which takes time. We can't be on a schedule, some template that is predetermined by a mid-level hospital administrator, non-physician person. And so Helios was really born out of this necessity to do it better the way we all intended to do it in the beginning when we started this. In my case, decided to be a doctor 40 years ago.
Yeah.
In otolaryngology, we have emergency conditions, sudden hearing loss, airway concerns, voice losses for people doing these kinds of things.
Right.
And the access 3 and 4 weeks later doesn't address their needs. So we were believing that if we could find a way to provide patients an approach to us that they could get in within a day, we know we could better care for them. And the physicians that are wanting to do that are the otolaryngologist in my group, which was originally Sound Health, been around for 20 plus years. And so we were looking for ways to innovate, find sustainability where we could have growth, find new doctors, attract them into our groups. And as we started to look at the options, we met Dr. Spellman and Dr. Polinsky and realized, well, they've already established a path that would do that. And so we started meeting with them and came to grips with that, hey, this would be a great path for us as well. And we do feel like we're leaving the dark, coming to the light for patients to get at that access we were hoping for.
As a patient, I think many of us just assume that something's wrong. You're going to go to, one of the hospitals in town, and whatever you need will be there, specialty or what have you, and you hope for the top quality. Is that not the case always?
Well, there are challenges, I think. As the communities try to provide everything all the time in every capacity at every institution, it's probably unrealistic to think that you're going to have the quality and the level of care that is commensurate with that.
Yeah.
And in most instances now, especially the way the world has morphed and moved, we can provide access without you having to necessarily be seen in a brick and mortar location. It's a very different way of thinking about it. Mm-hmm. And if we can navigate that care in a way where we can take out some of those barriers, where people really feel empowered to say, I'm going to find this physician very fast, very efficiently, and oh my gosh, they have access to see me today or tomorrow. We think we can make that conversation, that fear, that plan of action when you have a sick child or a family member or a spouse, we think we can take down a lot of barriers.
Your question is extremely important. How is it that people in our community are going to be able to identify the best doctors, the doctors who have legacy in the community, doctors that have legacy because for decades and decades we have been unwaveringly committed to integrity and quality. We felt like we needed to give that, for the community, give that enterprise a name, a captivating name that everyone in the community can know will provide for them what you're looking for your child, for your mother, for yourself. Mm-hmm. The best care in the world. That's Helios.
The best care in the world is really what we're striving for every patient who we want to care for, and to give that confidence that you can access that care and know that you're going to get it quickly. There's nothing more rewarding than when a mom comes in worried about one of their children, and we've got a quick access, a quick diagnosis, remedy to make them feel better, and you can see the angst, the worry leave the mom's face, and she knows she's going to have her child well cared for and get better quickly. That's very rewarding for us to see, and knowing that we can do that quickly with our ENT access points is paramount to our feeling we're doing our jobs as physicians.
Many of us are used to, you go to the doctor, or a lot of people don't even have primary care doctors anymore, but someone will refer you to the specialist. Like that's kind of like there's always a gatekeeper. Like you can't just go to the specialist. Is that necessarily the case anymore?
We're hoping that conversation changes. Some of the healthcare systems, might not have that specialist available, quite honestly. And if we can change the conversation to where the patient looks at the community and says, I know that this group of surgical specialists cover these things really, really well. These are the best. Let's figure out where they are, and I'm going to go there. And whether that's more than our 30 offices in the Metroplex area, including Illinois and Missouri, or whether that's the over dozen hospitals that we service in this community, we think we're building a pretty good footprint to where if you find Helios, you're going to find us pretty fast.
The primary care doctors, largely, the vast majority now, in our community are employed. They're employed by hospitals, by healthcare systems. Mm-hmm. And those systems pressure those individuals to refer for diagnostics, for specialty care in very specific ways. That may not always be in the best interest of the patient. Fortunately, patients now have very powerful tools in their hands, in their telephones, that allow them to figure out where the good doctors are. Mm-hmm. And we're trying to make that even more apparent to them by developing this enterprise, Helios. And thank goodness, patients still get to choose. Mm. And they do every day. My colleagues here and I are seeing patients that are jumping out of their healthcare systems, mm-hmm. Moving in directions that are different from what their primary care might suggest, because they understand the system to enough of an extent that they realize they've got to do their own, make independent research and make their own independent decisions about it.
Traditionally, access to a primary care physician, in theory, should have provided access directly to the specialist. With the insurance restrictions, with the financial restrictions, with a lot of the referral patterns, with the gatekeeper type of mm-hmm. mentality, those access points into that primary care world provide significant challenges for delays and also barriers as to where the patient should navigate. And what we'd like to do is have that be a direct announcement to the patient that we have the specialist available to see you. And as the insurance world morphs and changes, and as we realize that this kind of access point for the patient needs to be more direct and not delayed or not require multiple steps, we want to make sure that we're available to do that. So we've built the chassis to say, we're ready, we're here, we can see you tomorrow. And we don't need to think about those delays. Now, there's a very significant effort being put on the backside of that in managing our relationships with insurers, mm-hmm. managing our relationships with health systems, managing our relationships with things like urgent care centers in this facility, in this community, managing our relationships with the physicians in the community, making sure that they know that we'll do everything we can to see their patient and take out those barriers. We try very hard to be involved in almost every health systems conversation. We try very hard to be involved in access to most of the insurance plans. That is a effort that doesn't happen by accident. If you look at our site, the restrictions on patients not being able to see us for things like insurance plans, I will challenge is unique and very, very limited compared to the rest of the community. So it's a constant effort to try to maintain access.
I'd add one thing to that too, Matt. Communication's a big part of it, not just announcing our availability, but in following up with the primaries, letting them know what we've accomplished for their patients, getting word back to them promptly. That doesn't happen in some of the bigger systems.
Yeah, to Jim's point, the primary care doctors in our community, we want them to have our cell phone. We want them to talk about the patient. We don't want it to be some cryptic message somewhere that requires 3 or 4 levels of computer sign-ons to get to. We want to have that communication so that happens for the patient as fast as possible. I talked to 2 oncologists yesterday about patients with cancer. The patient was floored, saying, "You're going to call the doctor?" I said, "I'm on the phone with him right now." That should be the standard. And we believe that most physicians that we interact with, physicians in this community really want to take care of their patients. And so we want them to know if they want to have the specialist and our surgical specialties ready to go, all they have to do is let us know. We're ready to help.
I keep hearing this is going back to what you got into being a doctor for. I mean, it's treating patients, being there. So, How did this happen then? Were you talking to each other about, because I mean, you're all saying the same thing. So how did you guys come together to make this Helios?
When we were in the St. Louis market years ago and I entered this area, loving everything about St. Louis, but realizing at one point most doctors' offices were their office, and it was a small office of 2 or 3 physicians. That was somewhat the status quo. And now we're in an environment where the latest publishments suggest that about 50% of physicians now are employed. There's less than 50% are in their own practice.
Interesting.
And when we 3 entered that market, that was over 90%.
Really?
So
So
that
we're
is
talking about how many years is that?
Within a 20-year period.
Wow.
And most of those changes happened within the last 15. And whether they're economic pressures, insurance pressures, whether they're pressures of work-life balance, so on and so forth, all those variables have to be considered. But in the urology world, we had 3 groups in town that were functioning relatively well. But the fear of failure, that we were going to lose our independence and need to incorporate in such a way that we would need to be employed, was the driving factor that said, wait a second, can we do something bigger and better together? And it became obvious that we needed a little bit of size and a little bit of scale so that we could have conversations in the community where we could protect our patients. And then for some reason, I like to cycle, and I'm that guy on Clayton Road sometimes that you might want to run over. But to my left is Dr. Polinsky, and he would torture me going miles and miles and miles on a bike, and we would talk extensively about our challenges taking care of our patients.
Yeah.
But I would say that sparked our interest in thinking about this as a true multi-specialty with neurosurgery. And then meeting some of the physicians in the Sound Health Organization and understanding they were already doing this. They had this set. They had their own kind of service organization set, and we were doing this in tandem for no apparent reason because we had the same goals. And then that just became obvious and quite honestly easy.
Yeah.
To say we've got these great ENT doctors in town that are already doing almost exactly what we wanted to do.
Within Helios, the retention rate of doctors is amazing, right?
We really haven't had any physicians leave our group. It's very attractive to a physician to say, hey, listen, we've got a group here of your peers. We're going to help foster your career. We're going to help continue to train and really provide innovation. And you're going to stay independent and be in control of how you administer the care to your patient. That conversation between you and the patient, we're going to protect it.
Yeah.
And independence and innovation, that's really attractive to the physicians. We think about innovation not by having the fanciest cell phone or necessarily the fanciest piece of equipment, but innovation is having your peers with you in a room and your subspecialties. You know, we have subspecialists in every one of the sectors that far advances most of the academic centers in the region. Subspecialty trained, fellowship trained physicians with certain interest levels, and we're able to coordinate that innovation in a way where innovation starts at the top about people having conversations, and then figuring out what are the best pathways, what are the best technologies, what are the best instruments, what are the best service lines that we can offer our patients. That's a different conversation than having a imaging center built and then say, please fill it. We should probably have the conversation about we have all these patients that need this testing done, that need this evaluation. Let's get them to the best site of service, right? That's innovation. Innovation thinking about how the patient has pathways through the healthcare system to the best physicians. And patients deserve that. You know, they need to know that when they come to see us, and if it's a complex urothelial cancer, you know, that we have 2 of the top doctors in the world that are authorities on that, or a men's health reconstructive issue, or a female pelvic reconstructive issue, that this isn't something that they're going to get a doctor that's available. They're going to have access to the most innovative thought process given to them by physicians sitting down, planning for the patients to get to the right place at the right time. And we have thought about the innovation, we've thought about the independence, and we're going to get you to the right doctor. That's pretty cool.
You know, I'm sure that most people now realize that they don't know if they're going to have the same physician tomorrow or a month from now, that physicians are coming and going and leaving and turning over, and people are unhappy and moving from one practice to another and escaping a non-compete, so they leave the town for a little while. And so what happens to that patient? What happens is that the continuity of care is compromised. This doesn't happen in our organization. I mean, why does it not happen in our organization? Because we love our work. We're happy. We're not burned out. We're not frustrated. We take care of each other. We value each other. We leave each day feeling not undervalued or underappreciated, but valued by each other. We're not going anywhere. We're going to be here tomorrow. We're going to be here for years. So that's one side of the equation. The other side is recruitment. It is, Matt was telling you earlier about the scarcity of specialists in our country. Mm-hmm. It's not easy in general, for a group to recruit a really high quality new physician. That's not true in Helios. We don't really even actively recruit. We don't have to. They are enticed by this idea of being independent and being able to stay in control.
I think that's a really important point. The traditional model, as you alluded to 2-3 decades ago, was you leave med school, you go out into a private practice with one or two other partners, you have a mentor, somebody does the books, you write a couple scribbles on a chart note and it's done. Well, that doesn't exist anymore. You've got to have top-notch documentation. You've got to have human resource processes, IT processes, billing processes. It's a complicated business to run. And so this dwindling of the independent practitioner, the offices of 1s and 2s and 3s, it's just too expensive, too time-consuming to be a full-time physician and run a full-time business like that. And so the trend was for graduates to either go academic or go into an institution, be employed, and then not have to do any of that. And yet the dissatisfaction of working under those constraints wears some of them out. And Helios is offering an opportunity where we collectively can provide those services. You can come out and not have to run your own business, but be a part of a very effective function business without being constrained by institutions that have more regulations. Sometimes
it's almost as simple as talking to these superstars that come to us and these young doctors that are coming out in the environment. And when they're attracted to us, what they understand is the difference between a 2 to 3 year employment contract that could almost make their lives transient in some way, where that's a renewal of these employment contracts to coming and settling here as a career. It's a very different thing, right? That career focus where we want to build a home where we're going to allow you to practice the way that it's supposed to be done for the rest of your career.
What does all of this look like in practice? And I'm looking for patient stories. Can you give me an example of believing in a better way, what that does for a patient?
I can talk on the urology side. A lot of our practice is kidney stones. And let me tell you how you can be miserable in life really, really fast. Mm-hmm. And so creating that access is paramount. I mean, if those physicians need a hospital tertiary system to be cared for versus an outpatient surgical system, believe in a better way would be, we'll create access where we'll see you within 24 hours. If you're that sick and you need to be seen in a hospital, we're going to get you to the hospital where we're at. So we're going to provide care that should feel like, I'm in, I got you, right? And so the kidney stone patients, building that would be having a network and a online presence, 1-800 number, direct access in our patient care team, and we get them in right away.
Is that not happening right now?
It's really tough for patients because right now it feels like I need to get somewhere to get my pain under control.
Right.
And a lot of these patients have had stones before, so they know exactly what's going on. The thought of the only access point being an emergency room with possibly long lines and waits, and then not knowing the end game if they actually have a urologist on staff is terrifying, right? And so let's get rid of that.
Yeah.
Let's say, let us know. We got you. We need you at the hospital. We'll get you there. Most of the time, we can manage you as an outpatient. And then we can get your imaging test where it needs to be, get it done, looked at. We can get you to the right site of service, meaning whether you need a hospital or a surgery center. We can get you the medications you need to control the pain, so on and so forth. And so that paradigm is really fun to try to tackle because patients that have had kidney stones will raise their hand every time saying, just make it a better way.
That's right.
So maybe I had the layup on this question, but that for us, and honestly, that's been a 5-year project that we are kind of trying to maintain the way that we do that better and better every day.
Dr. Hartman.
And I'm sure members of the audience have had children with ear infections in the middle of the night, having fevers, crying, having to change the day's work the next day to get into an office somewhere, be seen, have an antibiotic prescription probably ordered, get to the pharmacy, fill it, start the antibiotic, hope that it works, have the process repeat in a couple weeks or 3 weeks, and that taxes their emotions dramatically. And it's very gratifying to be able to have those patients come in, say there's a solution to change this, and we can make you and your child's experience much better.
What's not always transparent to the patients is requisite and necessary is in these scenarios, this whole theme of innovation, right?
Yeah.
Most of that is how do we build the pathways for patients that are best for the patient? Yeah, so it starts with the patient and it ends with the patient. And in the middle, how do we do that? And what I mean by that is think about the terrifying event where you have an imaging study that might suggest there's a tumor in your spine or a brain tumor.
Yeah.
And that anxiety and that awfulness of that, and then getting access to maybe see a doc in a month. That doesn't seem acceptable, right, to where we are in our evolution as human beings and how we're responsive and care for each other. Think about that in a patient that has a kidney cancer or a bladder cancer or a tonsillar cancer. Those are obvious examples where if we can, behind the scenes, build that pathway for those physicians, where they can get access, and whether that's having nursing assistants, whether that's having navigating systems, whether that's having the right software, whether we're innovating in the way where we have the right diagnostics and therapeutics, is all intentional. Yeah. So those pathways are really important for patients when you think about individual patients. When they call and they have those problems, we know how to get you to the doctor. And that's different. That's different than having a situation where you say, oh my gosh, I got a call from a doctor saying I have this horrible thing and now I got to go find a specialist. Yeah. It's a terrifying event. And I think that anxiety lessening opportunity is something that takes a lot of work, time, talent, and treasure to build. That's a lot what Helios is. That's built.
I had a new tonsil cancer yesterday. Patient walked in with a sore throat to our same-day access. The nurse practitioner saw him, said, you got to come see it. I walked in, talked to him, told him what he was going to be dealing with, did a biopsy. He'll have the answer in 2 days, and we'll start his treatment regime in probably a week or two.
Yeah, but that access and the amount of time that you just talked, that all happened in one visit?
Yeah, one visit.
Yeah.
Now, there was a lot of legwork to get us there, but that one individual is what we're targeting. We're trying to say, how can we make his experience the best it can be?
I want to know why each of you are so very passionate about this. This takes a lot of time. This takes a lot, outside of what you do as a practicing doctor to form this Helios and keep all this to the forefront. Why do you do it?
Personally, I have a son in medical school now, and reflection on that over the years where he was thinking about doing that, and what that meant, and what that should look like, really reinforced where we're going. I would love to hand off a structure like Helios to say, I think we've got something really special for you and your colleagues. We want to give that to you, and we want this thing to be sustainable. But it all started with this. It's an interesting thing when it starts with fear. Fear that you're going to lose the autonomy between you and that patient. And it's such a gratifying thing when it changes into hope, right? So that transition from starting this on, I'm really fearful, we're changing the way we have that relationship. And now I'm so hopeful that our patients will have access and have that relationship maintained. So it was always fun, but now it's really fun. So that's the way I would say it.
I would largely echo that. I think for me, the passion started probably 40 years ago. When I realized that I could, apply my scientific, intellectual interests to making people better. That is something that inspired tremendous passion. And what I felt happening, and Matt just alluded to this, was, that our ability to carry out our mission was starting to be threatened and compromised. And so this organization, Helios, has opened the door again. It's created the environment, the platform that has vigorously reinvigorated me and my passion. I mean, I'm passionate about the discipline of neurosurgery, but to be able to do this for ourselves, but for the next generation of urologists, otolaryngologists, neurosurgeons, whatever it may be, we are building something that will, in a way, sustain what we consider the practice of medicine the way it should be.
Yeah, that's critical. I use that word sustainability a lot, and I'm going to age out of medicine at some point in my life, and I didn't want the patients that I'd cared for, to then just be left behind. And so we need younger physicians to come in, and we wanted them to be excited about practicing medicine, not being an employed doctor. And so we're finding it harder and harder on our own to find that path. And with the kind of collegiality we've developed here, we know we've got a path forward where it's going to work. I've got a daughter that's now an otolaryngology resident. I didn't do this with her in mind, but this will be here for her, and if it's the right fit for her, it'll be fantastic. If she goes on to do something else, it'll be another otolaryngology resident that can come to this practice, care for the patients that I did in a manner similar to what I did, and the patients will continue to be well cared for.
Is there anything else that the three of you would like to touch on?
Well, it's interesting. This collaboration has opened my eyes to fields that I knew somewhat about, but not much. And I've got patients that are aging with their hearing loss, and many of those are now having urologic problems. And so in learning about some of the endeavors that the urology group is pioneering and bringing to St. Louis, I've started referring, and the access is amazing. So patients with kidney stones, but more often prostate hypertrophy, I can get them in and get them treated in novel ways that I would have said, go talk to your primary, let them figure it out, and I can end around that and speed the process up. I can call my neurosurgery buddy and say, I've got somebody that's important to me in pain in their back. What can we do? And it's a very expeditious way to get them the right care.
I think that what's really exciting too is that as we collaborate, it's not just additional in a linear way. I mean, this is all very synergistic. We're more than 3 times better because we're just 3. I mean, we are really. There are many synergies that we share, and we're making each other much better, much faster.
I have 2 of my kids back from college and med school breaks seeing 2 of Jim's partners this week. So, to your point,
right.
It's fantastic because I know who the voice specialist is, and,
right.
and it's been great. And I would echo that this learning curve between the specialties is fascinating because we do get in silos where we think a lot about urology and neurosurgery and ENT. But one example of that is we've built a multidisciplinary surgery center. Mm-hmm. That's the definition of innovation, right? Because if you think about the patient experience there, and it's right now it's urology and neurosurgery, and pretty highly likely we'll evolve that into the other specialties. What does that mean? Well, when we think about that platform, we're going to go get the best people that have the best experience and will give the best outcome. Our nursing staff, our managerial staff, and then our access to all of the industry. And people are sometimes threatened about what industry means, but what that means is we're going to bring in the best instruments, the best tools, the best treatments. And it starts at the top where you have now a outpatient surgical experience for neurosurgical and urology patients in a way where that's been very intentfully thought of. Mm-hmm. You know when you go there that you have the best staff hand-chosen and hand-wanting to be there to take care of those very special disease processes and ailments. And so that's been a tremendous collaboration. And when we think about doing spine surgery and advanced urologic surgery and female reconstructive surgery and male reconstructive surgery and fertility and infertility work and all these things in that same setting where now we as the physicians have the control to think about how that affects the patient. And that's pretty special, and it's pretty neat. But that's another example of kind of what we've evolved into over the last few years, and the patient experiences there are tremendous.
Oh, yeah. And, this idea that we're a group of, really happy doctors showing up to do our job with passion and compassion, and that's palpable to everyone in the environment, including the staff.
Both bring up an important point. Although we've focused on the three of us today and our physician colleagues, there's a whole family in our company of providers, staff, and additional providers that are nurse practitioners or PAs, physician assistants, schedulers, nurses, MAs, audiologists, speech therapists, I'm sure nursing specialists for you, the OR staff. It's an large team that really, we cherry pick the best people, have the best experience, and want them to be happy working here because it makes the patient experience a much better one.
Well, it says a lot to me when you hear about doctors sending their loved ones to doctors within your group, right? That says, because you want to send them to the best. So that's always, I think, an interesting thing to hear as well.
Dr. Polinsky's my doctor.
Yeah. That says a lot, though, when you're going to the people.
Absolutely.
That says
no
a lot
doubt.
to me.
Right.
You want to go to the doctor's doctor.
Right.
Yeah.
Yeah.
Dr. Spellman, Dr. Polinsky, Dr. Hartman, thank you so much for this conversation. It's been very interesting.
Ton of fun. Appreciate you very much.
My pleasure.
Thank you.
It's a pleasure.